next is I'm going to demonstrate the administering intramuscular injection. Intramuscular injection are injections into the muscle tissues. There are different sites of the intramuscular, and these are the ventrogluteal site, vastus lateralis site, next is dorsogluteal site, next deltoid site, then last is rectus femoris site. So the purposes of the intramuscular is to provide the medication the client requires. So first is perform hand hygiene and observe the appropriate infection control procedures to prevent cross-contamination and transmission of microorganisms. So next is prepare the medication from the vial or ampoule for drug withdrawal. So I'm done preparing the vial or ampoule for a drug withdrawal. So we proceed to provide client's privacy, provides the client's comfort, and it is their basic right. So next is introduce self and verify the client's identity. So this is to ensure that the nurse is carrying out the procedure with the correct client and builds trust and cooperation as well. My name is Sheila May Oxtero, your student nurse today. And what is your name again, sir? Okay, sir. So next, assess the client to the position depending on the chosen site. In order for the nurse to have a better access to the appropriate site or location for the transmuscular injections. For vastus lateralis, or lie flat or supine with knee slightly flexed. The ventrogluteal, lie on side or back with the knee and hip slightly flexed. For dorsogluteal, lie prone with feet turned inward or on side with upper knee and hip flexed and placed in the front of the lower leg. The next is explain the purpose of the medication, including relevant information about the infection of the medication. Explaining the rationality increases the client's knowledge about the procedure and reduce anxiety. Okay, sir, I'm going to inject the medication to your skin, and this procedure have an effect if it is okay to you, sir. So next is select a site free of skin lesions, tenderness, swelling, or localized inflammation, and one that has not been frequently used. Plans indicates previous injection site where absorption was inadequate, assuming that I'm done choosing a site. So next is locate the exact site for injection to have the correct location for injections and to avoid damage to tissues. So next is put on clean gloves. So I'm done wearing my gloves to prevent possible transfer of microbes. So next is clean the site with an antiseptic swab. Use a circular motion. Start at the center and move outward about 5 cm or 2 inches. Allow skin to dry. So circular motion removes all the microorganisms or pathogens in the skin. This will also allow the skin to be prepared for injections. So next is remove the needle cover and discard without contaminating the needle. This is to make the equipment to be prepared for the next step. So next is hold the syringe between the thumb and forefinger of the dominant hand. Inject needle quickly and firmly at a 90-degree angle and insert the needle into the muscle. So this position keeps the fingers off to the plunger, preventing accidental medication loss while inserting the needle. Quick insertion is less painful. Next is release the skin. Releasing the skin when the needle is inserted is done to avoid injecting to impression tissues. So next is hold the barrel of the syringe steady with your non-dominant hand. Aspirate by pulling back on the plunger with your dominant hand. Aspirate for 5 to 10 seconds. A blood return indicates for needle placement. Possible adverse reaction may occur of the blood of the drug intended for intramuscular use. Slowly inject the medication. Repeat injection may be painful to the client. Injecting slowly promotes comfort, allowing time for the medication to disappear in the tissues. So next, quickly withdraw the needle while applying pressure with a dry sponge. Quick withdrawal of the needle of the less painful and reduce discomfort. Next is assist the client to a comfortable position to provide client's comfort. So next, discard the uncapped needle and syringe in a safe receptacle. Proper disposal prevents any possible injuries and the setting. Next is remove gloves and wash hands. This is to prevent transfer of microorganisms. The last is documentation all relevant information. Documentation provides coordination of care and facilitates ongoing data collection.